Right. Greetings, everyone on the call. It's about time we start this program. I want to welcome every one of us present on this call to this online interactive section that is focused on the theme Health for All. Health, as defined by the World Health Organization, refers to as a complete physical, mental, and social well-being, and not just the mere absence of disease or infirmities. And so it means that healthcare is expected to be accessible, is expected to be affordable, to all. And so this is the reason why we have gathered at this time to have a robust conversation as regards the topic. So we have seasoned healthcare professionals who are going to be, engaging us in this interactive section on accessibility to health, which focus on affordability of quality healthcare services to all individuals, regardless of their social economic status. We also talk about the health equity, that focuses, on addressing the root cause inequalities and profile solutions, of the burden of disease that we have. If we go in the way of prevention, we're likely to reduce them drastically. And of course, this reduces the burden, the financial burden on the healthcare system, and even, burden on the healthcare personnel. So this event is organized, hosted by SYNLAB Nigeria. SYNLAB Nigeria is a world-class medical diagnostic provider in Nigeria that offers excellent medical laboratory services, and we have a presence across major cities in this country. It will also interest you to know that SYNLAB is part of a global brand, that is present in 40 countries, in 4 continents, with the headquarters in Germany. We refer to as Europe's #1 medical diagnostic provider, and that is because SYNLAB is in partnership with major healthcare organizations around the United Kingdom. So like I said, we have seasoned healthcare professionals who will be taking us up, in this conversation this morning. The entire conversation is divided into 4 sections. Each of the speakers will take their respective topics and will have, the last section for questions. So I will advise, if you have questions, please drop your questions in the chat box, and we're going to take the question before we wrap up, our conversation this morning. I want to assure you that we're going to have a very robust time, and going forward from here, we are going to be equipped with information that would help us to forge ahead in terms of what we need to do, to make sure that the focus of this conversation, we're able to bring them to life. So on behalf of the Chief Executive Officer of SYNLAB Nigeria, I want to welcome you to this interactive conversation. I am Dr. Afolabi Obi. Thank you. And so I'm going to invite the first speaker for the presentation, who is going to anchor the first presentation this morning. He is a medical doctor, a certified chartered accountant with ACCI United Kingdom, where he was trained as a finance professional and he bagged some national and global award. He's been very passionate about accessible and affordable healthcare in Nigeria and across Africa. He has achieved results while working with some healthcare insurance business in Nigeria. And it will interest you to know that his most recent work is with Healer. That's an healthcare company he founded to achieve the seamless interaction of healthcare businesses to generate value while driving down care costs for both healthcare businesses and their end users using data science. He is an accomplished, resourceful, and goal-driven healthcare finance and tech professional. Join me to welcome to this call to take the session. Join me to welcome Dr. Dami Adeyemi Levites. Dr. Dami, you're welcome on board.
Yeah, thank you very much, Dr. Falabi. It's a privilege. Can you hear me very well?
Yes, very well. We can hear you.
All right, awesome. Thank you very much for the opportunity to be here today, to be able to talk about healthcare equity and then talk about healthcare tech as well. All right, so let me first of all start by saying this topic you gave me is something that I mean, if you say I should spend 15 minutes talking about, it's going to almost be impossible, but I'll definitely give it a try to make sure that I am able to do justice to it within that short period of time you've given to me. I'm trying to share my screen here, so just give me a minute to share my slide here. 1 minute, please. All right, let me share my entire screen then because of time. Can you see my screen?
Oh, yes, we can see your screen.
It's clear now?
Oh, yes, your screen is clear.
All right, yeah, so I'll just quickly run through. I hope I'll be able to do justice in 15 minutes, but I'll try and just skim through. And then when it's time for question and answer, we'll be able to elaborate further. So what I termed this short talk here on this morning is achieving healthcare equity through healthcare financing and tech solutions. So first of all, what's health equity? It's a state in which everyone has a fair and just opportunity to attain their highest level of health possible, right? And the availability and accessibility of healthcare financing driven by the right technology. Now, the word is the right technology. I will delve more into that in the coming slides. Using the right technology can significantly improve health equity and outcomes, right? And what's healthcare financing? Simply means the mechanisms and policies that are used to fund healthcare services. Financing options here can range from funding at healthcare business levels to even individual levels. So, for instance, healthcare businesses need funding, they need financing. So healthcare financing also covers the area of how these healthcare businesses get funded to drive value and deliver value to the individuals who access care at their facilities, be it hospitals or labs like SYNLAB, or even maybe pharma care and all that. Then the individuals also need to have funding, either through insurance or out-of-pocket payments. So you can see here that I talked about public and private health insurance, sources of funding. It can be tax-funded or government-funded healthcare programs and policies, and out-of-pocket payments also. I'll give you some data on the out-of-pocket payments shortly. So advancements in technology has revolutionized the way healthcare services are delivered globally, including healthcare financing services that I just talked about, being offered by health insurance companies and new tech companies offering the solution in Nigeria. So you cannot eliminate the importance of technology when it comes to healthcare financing. They actually have a synergistic role to play in achieving health equity out there. The use of technology can improve access to care, because someone who probably won't be able to speak with a doctor at Reddington in the past can, with the use of telehealth now, be able to talk to a doctor at Reddington without having to spend so much compared with before. And then there's increased efficiency, and then it enhances the quality of care provided as well. I'm just going to elaborate on that more too. Now, healthcare financing in Nigeria essentially is driven majorly when it comes to individual levels now, is driven essentially by health insurance. All right. So if there's lack of access to affordable health insurance in Nigeria or even globally, can result into lower use of preventive services that health insurance companies offer, delayed care seeking, and delayed care seeking definitely would lead to poorer health outcomes, all right? Because if you delay care seeking, you're going to get to the hospital really bad. And, people say, people die a lot at teaching hospitals. The reason is not far-fetched. It is the healthcare seeking behavior of individuals, poor preventive services, delayed care seeking that actually leads to poor health outcomes in those hospitals. In contrast, if you have a comprehensive health insurance coverage, you can increase access to care, promote preventive services, and improve healthcare outcomes. It's as simple as that. So money is a major driver for this thing, but I've talked about how technology and financing can work together and have a synergistic effect to actually make health equity possible. So let's look at healthcare financing proper. So how do we achieve healthcare financing and health equity through healthcare financing and tech solutions? First of all, health financing can reduce the financial barriers to accessing healthcare services by providing insurance coverage, like I said earlier on. So right now, what we have is that out-of-pocket payments in hospitals is about 70% of all healthcare expenditure in Nigeria at the moment. It means that for every time people go to the hospital to access care, 70% of that is being taken care of by people who are paying out of pocket. And if you are conversant with our economic indices, you can see that the poverty line is actually getting more serious than before. More people are poorer now in the last 3-5 years in Nigeria compared to how it was before. The middle class is being eroded gradually. So you are either very rich or you're very poor, because the naira value is getting depreciated. So your buying value is reducing for every naira you have. So what used to cost X amount of money in 3 years, 4 years ago is now costing about maybe 3X now the amount of money that you spent 3 years ago to access care. So out of pocket here being 70% is a lot. It means that Nigerians are paying a lot more for healthcare. All right. And NHIS has a critical role to play here. There's a new NHIS Act that can bridge this gap even further. But the problem with the NHIS Act is that there are many, many clauses there that need to be reviewed between the stakeholders who are in this industry. So the government has stated in that NHIS Act on how cash can be collected for every premium paid for health insurance in Nigeria for private health insurers, which doesn't favor the health insurance business in Nigeria as such. So there's been a lot of lobbying going on, a lot of conversations going on policy review to ensure that HMOs are still relevant when it comes to doing health insurance in Nigeria. State-run health insurance is there. The one for NHIS at the federal level is there, but there's still attendant problems, all right, that comes with, which can be solved when people actually do more of advocacy and collaboration, which I'm still going to talk about very soon, to make sure that all stakeholders actually play their role. The end game in mind should be that cost of care is driven down as much as reasonably possible. All right, that's what's going to achieve the health equity we're talking about here. Now, when technology is deployed rightly, all right, now I said deployed rightly earlier on. Let me explain that. By the use of product management, data science solutions to price health insurance products, we can actually improve the margin here and increase the amount of healthcare expenditure that is taken care of by health insurance. Right now, only 30% is taken care of by health insurance. But the reason is not far-fetched. Some people cannot afford health insurance and they only wait for the bad thing to happen, so they pay out of pocket in the hospital. And then there's a trust issue also in the industry, which can be taken care of also. That's not the topic for today, but those are factors. But at the health insurance business level, this data can actually change for the best. Health insurance can cover more than 50% of all healthcare expenditure in Nigeria, even a lot more than that, if some things are actually done rightly. If you price health insurance products rightly, you drive down care access costs. How do you do that? You use data science. In the previous healthcare businesses I've consulted for, one of them being HMOs, one thing I have discovered is that data is always lying in silos. And because data is not being well managed, no data science solutions being deployed, nobody's thinking about building a product around the data that has been accumulated in the past when it comes to health insurance business. A lot of products are either overpriced or underpriced. And so you're not getting the best value for every patient that buys health insurance in Nigeria. So what technology can do here is to deploy the use of product management skills, data science solutions to price health insurance products appropriately and drive down healthcare costs, improve the medical loss ratios of HMOs, and ultimately encourage the introduction of further discounts that is the burden, right, of bearing the cost of care by all stakeholders. So I did this at some point when I was at Reliance Health then, and what we did was very simple. Use data science to actually gather all the data we've had in the past concerning the people who have bought insurance from us in the past. I mean, based on biodata, location, industry that they are coming from, be it corporate portfolio or individuals, that's retail. And we're able to price products appropriately. Reliance was the first HMO in Nigeria that actually priced products for individuals, and they allowed them to pay monthly. That thing was just done very simply because technology was deployed in the right way. Data was used to make decisions where others have run away to say, retail business, I can't even do it. Then it used to even be retail business being financed by people paying annually, and it used to be very expensive. But Reliance was able to use that technology, using data science, product management, to actually innovate by bringing health insurance products into the market that are even cheaper. You can pay as low as 3,500 naira per month. I don't think that will change now. All right. And you can access primary care and even to an extent some level of secondary care. That's actually very innovative, and it's just driven by just one thing: using data science solutions to price insurance products to make it cheaper. Like, that's, if you make it cheaper, it means that you have more people who are going to access the same quality of care that they would have accessed with higher amount of money, because somebody has gone through the data points and have been able to come up with products that would actually give them lesser price to pay and then flexibility of even paying monthly. That was actually a very, very major innovation that was brought into the market. And I know technology can do a lot more than that. All right. I'll talk about blockchain. I'll talk about all that maybe in the next slide. So technology has been deployed also by some non-HMO healthcare financing companies in Nigeria today. CarePay is a very classic example. All right. CarePay does significant discounts. They offer it to card holders. Ateri Africa offers credit to healthcare businesses. And Health offers credit to individuals who want to access care, even at hospitals for primary care. You see, all these things I've said can actually help to ensure that everyone has access to basic health care, regardless of their financial status. And then, fortunately, primary care accounts for about 65% of all healthcare needs. That's huge, all right? And a very good example of health insurance company using tech finance model I just described, like I said earlier on, is Reliance Health. They also have a clinic that also manages these data points that help them to actually price health insurance products appropriately. Technology can play a role in improving healthcare quality by enabling data analytics at provider level, clinical decision support, and tools that help healthcare providers to deliver more effective evidence-based care. A very good example here is malaria. I mean, I've written something like that on my LinkedIn page before. I mean, when people say malaria is endemic in Nigeria, is that really true? Actually, like, is it really true that malaria is still like a big deal in Nigeria? Or are we having a problem of healthcare providers having poor technology solutions that would help them really, really define what malaria diagnosis really is? If you go to the hospital on the average, an average Nigerian doctor will tell you, oh, you have malaria. But actually, sometimes it's actually stress. What data points is informing people who are saying malaria is still very, very common in Nigeria? We need technology to be deployed in terms of diagnostics, fast diagnostics. As somebody comes to the hospital, you should be able to do some tests immediately on the spot to say somebody has malaria or not, so that you will not be wasting anti-malarial drugs when really this person doesn't really have malaria. So evidence-based care can be driven by technology, and that will drive down the cost of care. Some people, when I used to practice then, will come to the clinic and I'll ask them questions, and all the symptoms are not pointing towards malaria, but more towards stress. So I'll tell them, go and rest 1 or 2 days. Don't walk, don't sleep late in the night, sleep early, eat well, and then come back, let's have a conversation. And more often than not, they come back with, oh, doctor, I'm feeling better now. I didn't give them drugs. That has reduced how much healthcare costs they need to incur. And that's driving health equity. That's just an example. Digital health is a very, very viable tool for democratizing access to healthcare, achieving health equity. I'll talk more about digital health here. All right. So digital health solutions can drive down medical costs, like I said earlier on, from telehealth to EMRs to electronic health records to mobile health apps, inclusive of USSD and WhatsApp solutions, wearable device solutions. I mean, all these things can actually help to drive down healthcare costs. But there is a very critical part where stakeholders need to actually pay attention to, which is the fact that we have been deploying digital health in the past 10 years in Africa, but who is actually really measuring the real impact it has on the health outcomes and achieving health equity in the real sense of it? How are we measuring? What are the indices in Nigeria that is helping us to measure health equity? Are we measuring them closely? Our healthcare statistics like the GHS index, WHO ranking do not seem to be improving significantly. All right. I mean, our ranking recently was like maybe 160 something or 170 something. I mean, in terms of number, in terms of how well we are actually providing healthcare solutions in Nigeria compared to global standard. I mean, and we have 75 active and 15 inactive healthcare tech startup businesses. That's at 2022. So the number of digital health businesses are increasing, but the quality, or what we can say the indices to measure health equity, is not actually improving significantly. What's the reason? I just have one hypothesis. No significant healthcare data synergy. Very simple. No known seamless healthcare systems integration. Digital health data are currently existing in silos. There are healthcare businesses that, I mean, there was a point in time that a company in the UK wanted to set up an HMO in Nigeria, and they reached out to me to consult for them. And part of what part of what the challenge they had was that they can't sit in the UK and just get data about healthcare businesses in Nigeria. Nobody is actually putting this data out. Nobody is working on this data. And these data points are supposed to be the driving factor for how we price our health products, how we even do preventive care, all right? How we prevent diseases from happening, how we prevent communicable diseases from happening, how we prevent non-communicable diseases from happening. That would drive down healthcare costs on its own. So currently, all these things are existing in silos, all right? So even if you want to build healthcare products, you might not actually have full data. These questions are being attempted to be solved by some healthcare tech companies right now in Nigeria. Also, Innovesa, a healthcare tech company in the US and India, is doing something about this already. In Nigeria, HEALA, that's part of what led me to found HEALA then, which is a company that actually is geared towards bridging this gap, these data points, and making sure that there's seamless healthcare systems integration across all healthcare businesses in Nigeria. All right. Now, another thing we need to pay attention to is the fact that there is a lot of funding going on in the healthcare tech space right now. All right. In the last 2 to 3 years, about 5,900% growth in 2022 was experienced. But AI and blockchain-driven digital healthcare solutions may need to be paid more attention to in deploying these funds. A lot of people get this fund and they do more. Let's do telehealth. Let's do health insurance. Let's do healthcare finance. It's good, but this thing my time is up, right? Okay, I have like 2 minutes more. All these things are good, right? But if we actually want to solve this problem of health equity, right, we need to pay attention to blockchain-driven healthcare solutions and also pay attention to AI-driven healthcare solutions, all right? And apart from that, a collaborative drive is needed for healthcare tech companies to share data and drive better healthcare outcomes for end users, which are the patients, with government policies and healthcare spending interventions being influenced positively also. The most important thing here, I've written a lot on this also on my LinkedIn page and even on Punch newspapers. Implementation of the Abuja Declaration in Nigeria and executing this with no Nigerian factor. If we deploy the Abuja Declaration and make it happen the way it's supposed to be, then we would have health equity achieved to a large extent. There's a need for strong political will to make this happen. And I believe that all the stakeholders here, who are speakers here, and even those who are listening, would one way or the other contribute to this active driving of political will to ensure that we advocate for all health equity related efforts and make it a successful one. Thank you very much. I think I've spent my time wisely. If you have questions, that would be good to have. Thank you very much.
Right. Thank you very much, Dr. Dami. That's quite good. Even though within the limits of time, you were able to, deal with the issue. I quite appreciate you. And So people on the call, I am sure we have also learned a lot, especially information that would, challenge us to make us see that we still have a long way to go. However, we need to start from somewhere. And Dr. Dami has, spoken so well about healthcare equity. He laid emphasis on healthcare financings and channels that are available for healthcare financing. He mentioned the role of NHIS and the role of HMOs. He also talked about the government and private partners' involvement, and he particularly stressed, the willingness of the government to do the needful. And he also mentioned, and he was actually, quite emphatic about it, the need to employ data science driven solution, and of course the use of technology. And all of this is going to make, healthcare accessible. It's going to make it's also going to ensure, flexible payment plans. And of course, there is one, quite interesting, scenario he painted, the issue of malaria. Honestly, I quite agree with you completely. And until we really start to pull that data, that is when we know where our problem really lies. And that is where we are going to actually be able to know where to actually, invest, bulk of our finances. So once again, Dr. Dami, we want to thank you very much for your time. And we'll continue in this conversation. And we're going to invite our next speaker for the presentation this morning. Our next speaker is someone that is well known to us. He's a medical doctor. He's also a medical doctor that is passionate about healthcare information dissemination in Africa. And he also wants to make positive contribution towards improving healthcare delivery, in not too conventional way that we are used to. He has received the Lloyd's Achievement Award for 2021. He also received Impact Africa Award for Health Journalism, 2021. And also the Post Award for Health Influence 2021. He's an alumnus of Nnamdi Azikiwe University. So I want an award-winning content creator, a public speaker, and editor of Aproko.com. I want to welcome to this session, Dr. Chinozo Egemba, the popular Aproko doctor, is going to be engaging us, for the second session on preventive healthcare. Dr. Dami laid a foundation, making us to know that healthcare generally, it's primary, secondary, and tertiary healthcare. The bulk of the work we need to do on the primary healthcare has to do with healthcare prevention. And if we're able to prevent diseases, it reduces the pressure on our resources that are not so much, from all the things Dr. Dami had said. So we can appreciate the linking in all of this conversation. So Dr. Chinozo Ikemba, you are welcome to the call.
Thank you very much for having me in this conversation. I think I have been challenged by Dr. Dami's conversation, and it's one of the wonderful things that I've come to learn. And so today we want to talk about preventive healthcare and also talk about the role of, encouraging habits, that's healthy habits when it comes to preventive healthcare. And we need to understand that for a very long time, the medical community in every part of the world actually has focused on treating diseases, right? We've been focused on treating illnesses. And this made us more reactive rather than proactive. So we would wait for the diseases to happen, and then we will now treat it. But it led to a couple of problems, one of which was that these healthcare issues actually grew in severity before they were actually treated, right? And it led to more problems for the patients. And another problem that this can also lead to is the fact that the more severe a health issue is, the more expensive it is for everybody. And in a country like Nigeria, where a lot of people pay, and I think Dr. Dami even mentioned it, where a lot of people pay for medical expenses out of pockets, we can imagine how expensive it can be, right? It is expensive both for the hospitals, expensive for the patients if you're paying out of pocket, and it's also expensive for the insurance company. Rather than wait for it to be um, um, severe, why not treat it before it becomes more expensive for us to pay? Now, this now leads us to a couple of questions, and one of it is we need to understand what preventive healthcare is and why it matters exactly to patients and to people. One of the things that we also need to understand is that Nigeria as a country needs to focus on preventive healthcare. And the reason is the longer people are out of work because of illness or diseases, is Nigeria is losing, Nigeria is losing more money because people are out of work, because people are not able to contribute their own economical quota to the country at that particular point of time. So the whole saying "health is wealth" also applies to preventive healthcare. We need to understand that the fact that we need to focus on preventive healthcare does not only benefits the patients, but also benefits the country. Dr. Dami mentioned the Abuja Declaration, and that has been something that we need to pay attention to, because increasing budgetary costs, would also increase the amount of money that goes towards preventive campaigns. Now, when it comes to preventive healthcare generally, there are a couple of, I think I have some slides here. Okay, so when it comes to preventive healthcare, first of all, there are a couple of things that we need to focus on in preventive healthcare. And one of the most important things is screenings, right? There are some diseases that can be caught early enough beforehand. There are other diseases that, blood screenings, lab screenings for breast cancer, colorectal cancer, cervical cancer, prostate cancer. And this is also something that I've been trying to do with my NGO, the 100K Club. We initially, and I think that this is a story that I need to tell. When I started the 100K Club initially, the 100K Club was we wanted to help end health poverty. And we thought, okay, there are a couple of people that couldn't pay their health bills, right? And let's set up a fund where whenever somebody needs healthcare bills paid, we would pay for their medical bills free of charge. And it was a good idea at that point. So, we were very sentimental about it. We got a lot of public accord for that kind of project. And it was laudable. And quite a number of people joined us in this particular, cause, and they donated towards it. But what we realized was, for every 100 people that donate towards that cause, the money would probably go to one person. For example, we had paid close to 7 or 8 million naira at one particular point for a surgery that needed to be done for something that could be prevented. And the outcomes, even though we had spent so much money, the outcomes were not so good. And so we had to go back to the drawing table and think, what exactly can we do to be able to impact more people? And we decided to focus on preventive campaigns. So the 100K Club generally now is just focused on preventive campaigns. And in February 2021, in February 2022 rather, we screened 411 women in Lagos for cervical cancer, and the women who had some cervical changes were treated for free, and there were about 71 of them. That's 71 women who generally would probably not have known anything about this. So, and it may probably have progressed to cervical cancer, which will become more expensive to treat at that point. And so, meeting them at that particular point in time and treating it and preventing it helped quite a number of women. So screenings are very important. Screenings for blood pressure, cholesterol, diabetes is very important. Another very important thing is immunization. And these are the things that we need to focus on. Now, another thing that's often overlooked when it comes to preventive healthcare is public health and education. Which is basically promoting wellness through education and encouraging healthy behaviors. Because throughout my career in health information dissemination, public health education, and encouraging these healthy behaviors, what I've come to notice is that a lot of the outcomes in the health industry is based on certain behaviors that people have believed, right? Dr. Dabi mentioned something about camera. Dr. Dabi mentioned something about the patients coming into the hospital and they having malaria and it's just stress, and he tells them to go and rest. And I believe that his patients trust him a lot to actually take his ideas, because what some other patients in certain parts of the country will do is they would basically just go home, and when they are done, they would come back and say, they would probably go say things like, that doctor doesn't know what he's doing, and go to another pharmacy out there and probably just get drugs by themselves because they need to. And promoting healthy behaviors, for example, antibiotic resistance, which can be triggered by antibiotic abuse. For example, exercise, diets, several public health programs, both for children and adults. The importance of diet and exercise, the dangers of smoking, drugs, the dangers of alcohol. Promoting health-seeking behaviors, especially in Nigeria and in Africa, will actually go a long way to actually keeping us healthy, making sure that the country is that the country prospers, because quite a number of people are now promoting or are now contributing their own health, economic importance to the nation, and generally, save money all around, which will help us as a nation. So when it comes to disease and illness, public health measures in health programming, and this is something that needs to be often over and over again. And I believe that when it comes to promoting health behaviors, we need to speak to the patients or the people or the populace in a language that they can understand. So they need to understand what you're saying. They need to relate to it. It needs to come off as natural as possible. Because yes, I worked on a project with John Hopkins Center of Communication, talking about COVID-19 and and how to make sure that people uptake vaccines for COVID-19. And one of the methods we used was storytelling, which is something that I'm actually interested in. And when we actually had storytelling happen, we used in the form of movies, short movies that people could watch, short movies that people could pay attention to. Because if we also come to realize, and probably this is me digressing a bit, a lot of the habits that we learned, especially in Nigeria, from my interactions with, with the average Nigerian, came from the entertainment industry. It came from Nollywood. Oh, someone thinks, pour them water. Hollywood. Oh, cesarean section is bad. Hollywood. So we need to combat and actually preach the healthy message. Is my time up? We need to combat and preach the healthy message in a way that people can understand. So and I believe that this is something that budgets should also go into as a nation, so that we can help and help as many Nigerians as possible by making sure that healthy behaviors are promoted and people take their health-seeking behaviors seriously. But it will come off as something that we need to push over and over again until we get it. And of course, the results are there from my interaction with people. Quite a number of people who I've met at the gym, reaching out to me and saying, "Oh, the reason I actually registered at this gym is because of you. The reason I'm doing this is because of you. You've changed my ideas about certain things." But it doesn't just come up once; it comes as a repetitive, so that it can stay in your forefront and help change their perspective towards healthy behaviors and health-seeking behaviors. That way, they now become advertisers for, preventive health. And I think I would stop at this point so that we can have questions later. Thank you.
Right. Thank you so very much, Dr. Chinozo Ikemba, for the presentation. And please, if you have questions, please drop your question in the chat box so that we can take a question after. Dr. Chinozo has been able to, have a conversation with us at this session, regarding the need for, prevention. And, if I want to make a summary, a few things of what he has mentioned is, and made us to see, that prevention will help to reduce the risk for diseases, disabilities, and death. And he also emphasized that it reduces healthcare costs. It also reduces emotional instability when your friend or your relatives is an admission for things that ordinarily could have been prevented if he has employed preventive measures. It puts a lot of stress on us, as individual. It also reduced, waste of manpower. Time you're supposed to be at work, you're attending to your friends, relatives, and is on admission. And of course, it mentioned categorically, that preventive health care via the means that he has mentioned also helps to promote good quality of life. And he has mentioned a lot of ways by which we can do this. So we want to again specially appreciate you, Dr. Chinozo Ikemba. On a lighter note, you have acted Dr. Chinozo Ikemba. You have not acted apropos doctor. I was wondering why, because we know you as a people more of apropos than Dr. Chinozo Ikemba. But it's okay. It's okay. So again, thank you so very much. So we'll be going to the third section. Please, if you have questions, please drop your question on the chat box so that we can take your question at the end of this at the end of this at the end of this section. So we're going to the third. We're going to be discussing access to healthcare now. We're going to be talking about improving access to affordability, quality healthcare services for individual and for us as a people together. And so the person who is going to be, taking us on this section is an experienced business leader in the healthcare sector with a demonstrated background in medical diagnostic services. His skill set is in business process design, healthcare management, critical thinking and strategy, quality management, and change management, has also accelerated his career. He is a member of the Forbes Business Council. He holds an executive MBA in business administration and management, strategy and finance from INSEAD Business School. He is my personal boss. He's currently the chief executive officer of SYNLAB Nigeria, which of course is the industry leader in medical laboratory services in West Africa. I want you to join me to welcome Kenneth Okoli to take us for this session. You're welcome, sir.
Hello.
Hi.
Hi. Good morning. Good morning, everybody. Sorry to have everyone join this presentation or join this webinar. I've learned a lot from my very good friends and colleagues, Dr. Yemi and Dr. Chinonso. Well, not many of you know him, but I personally call him Bobby. So that's his the name we know him as. Okay, please confirm you can see my screen now.
No, we can't see your screen still.
Okay, not sure why. Please, just 1 minute. Let me just sort this out.
Not a problem.
Yeah.
Please, again, while the next presenter is trying to get the presentation to the screen, if you have questions, please let's drop our question on the chat box.
You can see now?
Not yet.
It should be loading. I can see that it is.
It's fine.
Able to see now?
No.
Okay, perhaps I'll just proceed so I don't take too much time. I don't know why it's not coming up. Okay, so I'll be talking on a very interesting topic. I titled it, I tried to reconfigure the title a bit, Access to Quality Healthcare in Nigeria, a critical need in Nigeria. And I'm sure having listened to Dr. Yemi and Dr. Chinonso, we understand why it's a critical need. But to perhaps give us more, how will I put it, enhance the sense of urgency on why it's a critical need, I would just take us through some statistics that would help us understand why I say so. So currently, at least based on available data, we're about 200 million people in Nigeria. And by 2050, it's projected that we'll be about 400 million people in Nigeria. That would be, I think, the third most populous country after China and India. Now, having listened to what Dr. Yemi and Dr. Mansour has talked about, I'm sure we all can attest to the fact that there is a challenge with healthcare delivery or access in the country. And there is an urgent need to fix that. And the problems, which the things that are actually making them are varied. And I'll be touching on a number of them as we proceed. Now, having said that, I would also want to take us through some other facts that are on ground, just to help heighten our attention on what needs to be done, and also bring to reality some of the challenges we're having in case we're not aware. So Nigeria is placed at 142 out of 195 countries, according to the Lancet report ranking of healthcare systems performance using healthcare access and quality as a criteria. Also, note, we're 142 out of 195 countries with regards to access to healthcare, proper quality healthcare. Now, according to the federal government reports, their second national strategic health development in between 2018 and 2022, it was stated that although access to healthcare for all Nigerians through the basic minimum package of health services is backed by the National Health Act, the package has faced huge challenges in dissemination and implementation, as several state governments are lacking in operationalizing it at ward levels. And I'll talk more on this as we proceed. According to the World Bank, there's an index which is part of the indexes used to measure development called the Human Capital Index. And Nigeria's Human Capital Index, I think, out of 1 is 0.36, which is actually below that of which is below the average in sub-Saharan Africa, which is 0.4. Now, what does the Human Capital Index mean, and what does 36% mean for us as Nigerians? It means that a child born in Nigeria today will be 36% as productive when she grows up as he or she would have enjoyed complete education and full health. Note, summarily, it means that you're only functioning on the average, the child is only functioning at only 36% of its capability. Okay, 36% of its capability. When you want to compare this to other developed countries like Singapore, Japan, and the rest, whereby the child is expected to function at about 80% or 85% of its full capability. And this is the same story when you go across most of the developing countries, especially in sub-Saharan Africa. And most important, or one of the most striking facts, is this, which is that the private sector provides close to 60% of health service delivery, in spite of owning an estimated 30% of health facilities in Nigeria. Now, why are all of these things important? The topic we're addressing again is access to quality healthcare. As Dr. Nonso mentioned, without access to quality healthcare, we're threatening the production capability of the nation, because it means that the majority of people who would be able to add to the production of the nation in terms of contributing economically, they are all at the risk of being ill or being facing one form of health challenge or the other that could easily be preventable or that could have easily been treated, because there's a poor access to quality health care. Now, when we talk about, for a number of people, especially those staying in Lagos, Abuja, Port Harcourt, those staying in the urban cities, a number of people may not really understand how intense these challenges are, because in Lagos you have Evercare, you have Reddington, you have many of the big hospitals. Okay, now this again is a challenge in our country, whereby healthcare access is very lopsided. Now, what do I mean by it's lopsided? The majority of the population actually are not staying in the urban centers, but are staying in the rural areas. And actually, the healthcare challenges that we have in the rural areas. Okay, yes, we still have challenges in the urban centers, but again, it creates a bit of like I said, a lopsided view, because a lot of people be like, but there are hospitals here and there. Can you say that there's no access? In reality, there is really not a lot of access, because in the rural areas where people face a lot of healthcare burdens, healthcare challenges, they do not have access, the same access you have to visiting doctors, seeing patients, seeing nurses. That does not exist. Now, the question now is, why is this so, and how do we fix it? Yes, we understand this is our story. This is our reality as of today. What do we need to do to fix it? Now, in fixing this, I like to paint a picture. And the picture, I really wish you could see my slide. The picture is...
We can see your slide now.
Oh, really? Oh, okay. All right. Okay. Is it, if I put it on PowerPoint mode, can you see? Can you still see it in PowerPoint mode?
Oh, yes.
Oh,
yes.
Okay. All right.
This is your slide. This is your third slide now.
Okay. All right. Good. Okay. So I'd like to paint a picture looking at our current state and our future state. And the current state is actually painting a picture of where we are currently, not looking at the outcomes. What I explained in the first slide and second slide are the outcomes, but what has really led to us this current state. And the first one is having to do with our infrastructure. But before I even go into mentioning that, in addressing the issue with access to quality healthcare in the country, worldwide, it has been established that in dealing with this issue, that there needs to be full attention placed on primary healthcare delivery, which currently is a big issue in the country. And when I was researching on this topic, it was interesting to note that as far back as 2018, the government, as far back as 2000 or 2005, made a plan that by 2018, at least one primary healthcare center in all the 773 wards, local governments in the country would be working. That's about 10,000 wards. That's 10,000 primary healthcare centers will be working. This is about 2018. As we speak, I'm not sure we have up to 35% of our primary healthcare centers functioning as they should. Okay, and what are some of the reasons for this? One, the infrastructures are bad. Okay, we have very poor infrastructure. I don't know how many of us can go to a primary healthcare center, even in Lagos, okay, to have a delivery, okay. And note, this is where a lot of people who are poor would actually go to have deliveries, go to have checkups, and all of that. Yes, Lagos is a bit fair, but compare, if you say Lagos is fair, compared to what is happening maybe in other states like Abia, Ekiti, Nasarawa, just think about what it looks like there. Governance. The governance structure in our healthcare industry, with all due respect to everybody involved, I would say is still very weak. The accountability systems are very weak. It's fraught with corruption along the procurement systems and a lot of issues which time will not avail us to delve into. We also have a human resource challenge, inadequate supply of the required human resources, and also compounded by the skilled migration of the skilled workforce, which is a major issue that needs to be dealt with if we're going to be able to move away from where we are today. Financing is a very poor issue. It's a very big issue. Like Dr. Yemi and Dr. Chinonso alluded to, there was the Abuja Declaration a few years back, whereby all the heads of states in all the African countries came together and agreed that 15% of the budget would be provided, would be dedicated towards healthcare delivery, providing for healthcare, financing healthcare. The truth of the matter is that looking at the 2023 budget, less than 5% of the budget was actually being provided for or being allocated for healthcare delivery. Okay, and this then puts a pressure on the population, on people to have to pay for a lot of things from out of their pockets. The last aspect which defines our current state is private sector intervention. Currently, the private sector intervention is marginal. Beyond it being marginal, we also have an issue that it is poorly regulated. Now, what do I mean? You have almost anybody who graduates, anybody who can use a stethoscope, or anybody who read medical laboratory science or who read nursing wants to own a pharmacy, wants to own his own lab, wants to own his own hospital, and there is poor regulation, thereby making it difficult to deliver the right kind of services that will be required for people to be able to thrive and for people to be able to get the kind of healthcare service that they desire. Now, if we're going to be able to move away from here, we need a desired future state. And the desired future state is a situation whereby the infrastructure which we need is functional and is excellently maintained. Now, the challenge with these is that to arrive at this state, there needs to be a lot of correction that needs to happen within the administration of healthcare facilities, provision of resources at the primary healthcare level. Okay, the healthcare is in the concurrent, what is referred to as a concurrent, sorry, I'm not governance part, but it's the federal government, the state government, and the local government have a role to play in ensuring the delivery of proper healthcare to people. And until this is actually done and done correctly, we'll keep having a problem in this space. The second aspect, which for me is a major problem, is governance. Yes, it's for true, there is poor funding for healthcare. We completely agree with that. We completely understand that. But one thing that needs to be dealt with, and it affects everything in the country, is the aspect of accountability. The little funding that is being provided, how well is it being utilized? How much of it is finding its way into private pockets? How is this being addressed? Until we have strong accountability frameworks that ensure professionalism and proper utilization of resources, we would not get the desired access to quality healthcare that we eagerly require as a nation, considering that our population is escalating quite rapidly. Human resources. Yes, we have a challenge with shortage of human resources, but more pertinent, and I can say that authoritatively, being someone in the business space and having to hire healthcare workers daily, is the fact that the training being offered in our institutions and the reality in the marketplace is wide apart. Okay, and this creates a problem whereby those who are able to train themselves or those who get further trainings abroad are those who then have the burden of actually driving service. There is a need for us to correct the curriculum. There's a need for us to improve the quality of training being offered. And more importantly, to stem the tide of migration. I cannot promise that people will stop migrating, because even in the US, you have the US nurses migrating to Australia where they are better paid and all of that. We need to find a way to deal with the issue of the remuneration and payment. Everything is not about money, but the remuneration being given to healthcare workers. In Nigeria, it's quite poor, particularly in the public sector, and it needs to be improved. If it's not equitable, if it's not reasonable, we would not be able to stop the migration, no matter the policies we put in place. And what makes this worse is that it's just going to, no matter the infrastructure we put in place, if that is not fixed, we are not going to come out of the woods. The fourth aspect is financing. We need adequate financing. The Abuja Declaration said 15%. Even if we can get 10% of the budget allocated to healthcare, having dealt with the number 2 factor, which is governance, meaning that there's proper accountability and we can guarantee that these funds are being utilized correctly, I am sure that we will be able to see some progress, okay? Because this will then lead to effective implementation of the Universal Basic Health Coverage Act. The Universal Basic Health Coverage Act currently requires that 1% of the funds in the FEC account goes to healthcare, okay? But yes, that is not enough, okay? But if we can ensure that the number 2 aspect, which I keep going back to, is dealt with, then when you even add more money, you can be guaranteed that it will be utilized for what it's supposed to be used for. Now, the last part, which is private sector intervention, which is where we come in as private sector players and have a role to play in improving, because healthcare is not just a role for the government. We need proper regulation within the healthcare space. And I don't think it's a function of writing more policies or putting together more policies. I think it's a function of political will to implement what has already been put in place. All right? We need to, the same thing that was done to the banking sector some years ago, where we consolidated banks to allow for better professionalism, better output from the banks. Similar thing needs to be done for the healthcare sector. There needs to be a focus and a drive to ensuring that only facilities that meet a minimum standard that is of global acceptance are allowed to operate. That way, we bring some sanity to the quality of service that is being delivered. All right? Now, when that is being dealt with, we also need to find a way to integrate the private sector into working with the public sector. Currently, SYNLAB does that in its own little way by setting up some public-private partnerships with different teaching hospitals. And the singular goal for this is to bring quality healthcare closer to the people. Now, I cannot begin to explain the many testimonials that has come out of this in terms of the fact that a lot of people, a lot of doctors are happy with the fact that they are able to access quality care, get accurate results, which ultimately helps improve the outcomes that they are expecting for their patients. Imagine the challenge you have to go through as a doctor, whereby you want to run a test as simple as an electrolyte urine creatinine test, okay? And then you have to wait maybe 2 days or wait a full day to get a result. Imagine the frustration, especially when it is a critical need that you need to be able to give intervention to a patient, okay? Now, we understand the current challenges within most of our tertiary institutions, and this is why, as an organization, we took the opportunity to work with the governments, both state governments and federal governments, to see how we can partner in this regard to help improve the quality of care, at least as a stopgap, pending when all the other issues that I mentioned are resolved. Having said this, it's my hope that if we can pay attention to these things that I have illustrated here, there is some inclination that we would see some changes, at least within the next half a decade to a decade. But rest assured, it requires strong political will and a lot of effort from every stakeholder. Thank you very much.
Yes, thank you very much, dear Chief Executive Officer Kenneth Okoli, for your presentation. And think yours, it's, this slide had said it all. I think it's more of a summary of all the two conversations, although the two person who had presented. So again, I want to thank you so very much. So we'll go to our questions now. Please, if you have question, please drop your question in the chat box so that we can take the question now. Question 1 comes from Michael. I think this question, I will appreciate if Dr. Dami and Mr. Kenneth Okoli would, respond to this question. We cannot tackle healthcare if poverty is not well addressed. Majority of Nigerians suffer from diseases which couldn't be prevented if they actually lived above the poverty level, which could be prevented if they lived above the poverty level. This does not mean that those who are not poor do not get these diseases, but we're talking about the majority here. So the question, how do we tackle this trend while preaching the gospel of preventive healthcare across all economic and social strata? I hope Dami and Kenneth got the question. Would you want to make a response to that question? Thank you. Yes, I think Dr. Dami can come first.
Yeah, so the first thing first is this. Poverty is a global phenomenon. If you go to the street of New York, you see poor people there who don't have access to care.
I think that people need to know that.
Yeah, it's a global phenomenon. It's like asking what's the solution to the problems of the world. But we can actually start by saying this. Nigeria is blessed with so much that can be done easily, all right? Our PHCs, if they can be revamped, I made reference to a post I did on LinkedIn some time ago about solving healthcare problems in Nigeria as simple as ABC. If we take care of PHCs very well, I did some maths on how much we have even as budgeting, the budget we have for healthcare rather in 2022. And I used that figure and I broke it down to how much it would cost us to have PHCs revamped. I didn't talk about revamping, I even talked about building from scratch. And I calculated the number of PHCs we need on a yearly basis that we can build and make it functional, deploy telemedicine and telehealth solutions to make it cheaper, all right, to access. I mean, if you take care of PHCs, you would solve the problem of access to care. At PHC level, you can actually run some preventive care to a large extent. You can do education like Dr. Chinonso has mentioned. You can do a lot of preventive care at PHC level. Primary health care accounts for over 65% of all healthcare needs, like I said earlier on. So if PHC is taking care of that, then no matter how poor you are, as long as the government keeps funding those PHCs, paying the doctors when they're supposed to pay, medical supplies coming in there, which can be taken care of even with the current budget of healthcare, if the money is properly managed. That brings me to political will. So if there is strong political will, if there is no Nigerian factor coming to fore, the cash, the budget that has been earmarked for healthcare, if well managed, not pilfered, not mismanaged, can actually really take care of healthcare needs of basic of an average Nigerian out there, even without having to pay out of pocket. And then you can now start talking about health insurance for those who probably want to do more secondary care and tertiary care and all that. But basic healthcare can be taken care of by just the government doing the right thing. So that political will, strong political will, advocacy for government getting to execute all the Abuja Declaration we've talked about. I always say, Nigeria's problem is very simple. Let everybody just go to Abuja Declaration, look at what it says, let the government do their part, let healthcare providers do their part, and everybody is going to be fine. Well, I don't know if I think Kenneth will have something to say about that too.
Yes, Kenneth, please, what's your input to this question? Please, did you get a question quite correctly?
Oh, yeah.
Right,
Yes, I got the question.
You can go ahead.
Okay, so like Dr. Dami said, first of all, even the Bible said the poor will always be in your midst. So there would always be poor people in our midst. However, I think the responsibility of governments actually, is to the people and to protect its people. And I think that we can actually start very small. I'll take an example from India. So in India, they were having a lot of maternal mortality cases at some point. And they realized that if they could do proper ultrasound early on for people, they would be able to at least prevent a lot of the child mortality that before even the kids were born. And I'm just as an example, please, and I would explain why. But then note, there is the component of the ultrasound machine. There's a component of trained personnel who would have gone to school and all of that, okay? But they decided to disaggregate or break down the problem, okay? There is no point getting people they don't have a lot of people who are fully trained enough, even in the whole country, to then be able to move them to the rural areas. What did they decide to do? They decided to take young ladies, who were already in the rural areas and taught them just the exact thing they needed to know with regards to ultrasound. Just this, not the complex ultrasound, just the exact thing they needed to know in terms of just check this, record this, report this, and results get transmitted to more experienced professionals. Now, what did that do? That created immediate penetration. Of course, the government will was being used to ultrasound machines in the villages and all of that. Now, taking that as an example, if I go to a village or a market, or let me say a small rural area, and we do proper public health correctly, and we realize the basic problem in this space is that the environment is dirty. And I'm coming back to what Dr. Chinoso said with regards to preventative health, because healthcare is not all about just going to access the care when the thing has materialized. Also, we can start from prevention. I think it's even more critical to start with prevention in a place like Africa or in Nigeria, where we don't have the healthcare facilities in itself. First of all, remember what happened during COVID? We had to wear our masks because we didn't have the healthcare facilities and all of that to cater for people who will be dropping down or who will get ill. Now, imagine if we take that as an example and go to a village, identify, there's an issue with malaria in this village. What is the root cause of the malaria? Is poor water supply or the stagnant water. Get people within the village or within that locality to understand that, train them well enough to be able to manage or deal with that issue, give them the right interventions, okay? Now, when you do that, even if you provide a health care, primary health space, the body won't be too much on them. But what is most critical is that you're arming them to take or manage their own health care by themselves. Now, this would ensure that it's only things that are really critical that ends up getting to the primary healthcare facilities. Note, why I'm saying this is because we are at a space whereby with healthcare interventions we will deploy, if these things are not done, each of these facilities will be overburdened. Right. I've been to several primary healthcare facilities, even in Lagos, okay? And even the environment where the primary healthcare facility is nothing to write home about. Okay, so I hope that gives some perspective to that question.
Thank you so very much. I want to believe we have addressed the question asked by Michael, and I'm sure that all of us on this call, we have also benefited from that response. Just a quick recap. We could see from the two speakers the critical issues here. Number one, there should be a data-driven decision making. It's quite important from that conversation. Number two is political will, the role of government. Number three, it's also important that we'll find a way to eliminate the Nigerian factor. And of course, that depends on not only the government, including me and you. We are the government that, we choose. We'll decide the type of government that we want. So whatsoever thing we see, happening at the corridor of power, we have also contributed to it directly or indirectly. And number 4, there is a need for periodic evaluation so that you know where to make improvement. I want to believe that answer the question. So we'll go to the next question by Sumadina. Sumadina asked, what can be done to address healthcare polarization in Nigeria? And I will appreciate if Dr. Dami can speak to this. What can be done to address healthcare polarization in Nigeria? Please, let's be brief. We have a number of questions. Thank you.
Okay, yeah. So let's ask ourselves, what's polarization to start with? Polarization simply means division into sharply contrasting groups or sets of opinions or beliefs, or having two very different groups of people. So anyone who falls sick now in Nigeria can either go to the big hospitals or can go to the regular hospitals, let's use that word. And some don't even have anywhere to go. So the polarization here might even be like we have more than 2 groups here. Those who can't even afford healthcare at all, or those who can afford to an extent, and those who can actually afford quality healthcare, which is very expensive. So it boils down to the same thing we've been talking about, equity. So it's like asking the question in a flip manner to say, how do we achieve health equity? It's still the same thing. We've talked about a lot today. But first of all, we've talked about political will. And I think I want to dwell less on that now because that has been overflowed. But I think part of what can also be done, which I have tried to do as much as possible within the power that I have, is through an NGO called Life Crown Foundation. So what we do at Life Crown Foundation is that we go to rural areas, right? And we meet people who live in huts and clay houses, like real remote areas, who do not have access to healthcare, whose nearest hospital is about maybe 12 kilometers or 15 kilometers from them. We take drugs there, all right, as an NGO. We package some food stuff for them as well. Care. We screen them. Anyone that needs secondary care, we refer them to this health care center that is closest to them, this general hospital closest to them. And that has actually helped those villages. I mean, there were reports, in fact, that even helped us to even acquire this UN ECOSOC accreditation at some point because we were keeping data of all these things. Now, I've thought about it on a larger scale to say, if this thing is done on a larger scale by a number of NGOs not interested in making money, but really interested in impact, we are going to reduce the amount of people who are polarized in terms of access to care in Nigeria. So we focused on Lagos, for instance, and I know there are a number of NGOs out there. So what I always tell people is, within your own power, what can you do? Have a security guard who falls ill often. And there was a day I asked him, like, you have a smartphone, right? And he said yes. And I said, okay, let's do it this way. I know there's a plan that I've created somewhere I've worked before, and that's Reliance Health. 3,500 naira per month. I can take care of your basic primary care with 3,500 naira per month. You can get drugs for malaria, anything primary care, even down to admission after we've paid for some months. So I have thought about how to create that in a larger sphere to say, can we have NGOs who can actually partner with banks to do this at a CSR level? So if we keep waiting for the government, we won't get things done. But we can do things in our own little ways like that to reduce the polarization, to allow people in such rural areas who don't have access to healthcare by, first of all, giving them access to this kind of health insurance products, like I said, as cheap as 3,500 naira per month per head, all right? And then also, I mean, I know banks do CSRs, there are oil companies who do CSRs. That was the phase we were in at the NGO, and that's where we still are right now, putting some things together to say, let's sell this as a CSR initiative. Now, that is at my end. I am sure every one of us on this call will have one person or the other that we can actually collaborate with. So it's like private collaboration would actually reduce the polarization we're talking about, aside lobbying for strong political will. Lobbying for strong political will might not solve the problem overnight. It might take a longer time. We know what our political landscape in Nigeria looks like right now. But while waiting for that to happen, while waiting for good governance to actually take shape, we can actually start. In fact, we have gone as far as creating 2 PHCs as we speak from this NGO. All right. I mean, 2 PHCs that are addressing primary healthcare needs of people within those rural areas. We've established schools. Somebody talked about how do we reduce poverty? How do we help reduce poverty? If you educate people, poverty will reduce. So we have set up schools in all these villages. There are 2 schools we've set up right now that is taking care of that. So if everyone really, really wants to do it very well, there is always that private drive as well that can take care of reducing this polarization and improving access to care. Yeah, it's expensive, but can be made cheaper if we all do our own bits one step at a time. I think that solves the problem. Thank you.
You're muted. Dr.
Yeah,
Obi,
you're muted. Dr. Obi, you're muted.
Oh, thank you so much, Dr. Dami. So Martina, I think he actually explained the question more. I would not want to go over that because Dr. Dami has appropriately addressed that question. I will appreciate if the 3 presenters on the call will make their brief response to this question. And the question is from Betsy Eziako. What is the role of health literacy in the 3 sub-themes that we have discussed? Financing, prevention, and quality. What is the role of health literacy in all these conversations that we've had today? So we can start from apropos doctor. I hope you will be the apropos doctor in answering this question. All right.
Thank
So
you.
going into that, apropos doctor.
Thank you. Thank you very much, Betsy, for that. Okay. Thank you. Thank you very much, Betsy, for that question. Health literacy is actually very pivotal when it comes to health financing, quality of healthcare, because just as Kenneth spoke, he said something about the quality of healthcare, and when people are literate about their health, they know where they need to go to get the kind of health that they deserve, because it's not just the kind of health that's available, it's the kind of health that they deserve, right? We have people in very rural communities that just because they cannot access healthcare, or because they don't know any better, they go for quote and unquote interventions that may actually lead to more severe outcomes. For example, we have traditional bone setters in many places here in Lagos, for instance, and it is simply because people are not health literate. That is why they go for services like that. We have agbo sellers somewhere, in many rural areas, even in the, urban cities. We have quite a number of these, drugs that are on social media right now. And part of what we are trying to do is to help increase the health literacy of these people so that they can, before, looking for what is not there, at least stop patronizing these other guys. Because the moment that happens, then there is now more demand for better quality healthcare, and the providers of healthcare will now be forced to actually step up the quality of their healthcare, right? Labs, for instance, we have people, these are certain things that are even rampant on the streets. You have places where they tell you, oh, sit down, and there's this that will scan your whole body and tell you what is wrong with you. And people are paying good money for that. And they sit down, they attach a probe to both hands, and but and you will be shocked at the kind of people who are patronizing, people like this, because you would expect, oh, this person went to university, so there's no reason why you should fall for something like this. But just because a person has achieved, 3 levels of education does not actually mean that they're health literates. So encourage, making sure that people are having the adequate information about their health, making them health literate can lead to better health and better health outcomes, can lead to more provision of quality healthcare, because we now know that, oh, these people no longer fall for things like this, so we might as well provide them what is real, and once that happens, we would actually achieve a lot when it comes to quality healthcare. I would leave Dr. Damian to talk about health equity.
Thank you so much, apropos doctor. Permit me to continually call you apropos doctor going forward. Please, I would permit me to disallow you from responding to this question because of our time. We have quite a number of questions, and we're all busy in our various work, and I would want us to return back to our schedule, within the next 15, 20 minutes, so that we can end this section. So this question is directed to the CEO of SYNLAB Nigeria. He says, my question goes to Ken. Corruption is the reason why regulations are not well treated to eradicate some private health centers, because they are actually messing things up. I'm a young biomedical engineer. Most times when I visit their center for 1 or 2 basic repairs, you will get to see a private lab managing, for example, a suction machine that should have been discarded or given proper maintenance. I guess the question continues. Please use your position to help act urgently on the need of what is taught. I mean, the question is not so clear, actually. This question is not so clear.
Don't worry, I understand.
Oh, you understand, right?
I'll just take 2 of them. Yeah, I'll take 2 of them quickly so that we can wrap up. So the first question regarding corruption or which is the reason for poor regulation. Sadly, any nation, any country that doesn't get its policies and regulatory arm fixed really cannot move forward. And the only thing we can do as private sector players who are interested in driving development for the nation is continue to advocate and continue to shed light where we see that things need to be done, and continue to act differently. Because really beyond that, and also when the opportunity presents itself, we should use the polls to elect officers that we feel that can do the right thing. Because currently what we need leaders who love the people well enough to be able to do the right thing. Okay. There is something, the problem with, and I would elaborate this beyond just Nigeria, with most African nations, is that a lot of the time the elites and the leaders are very, very selfish to think more about themselves than for the people. All right. Because the same people who would obey traffic lights in the country, who would not obey traffic lights in Nigeria at 7 p.m., okay, would obey traffic lights at 10 p.m. in Paris. Okay, why? Because there are consequences. Now, the reason why things are the way they are is because there are no consequences. Until we begin to implement the clearly spelled out consequences when people misbehave, we would not get correct. Okay, and I cannot overemphasize that enough. We need to ensure that there are consequences when people do the wrong things, okay? And regardless of who the person is, the consequences follow through. If we don't have that being implemented, then we'll keep speaking, we'll keep talking. But it's my hope that things will change. We'll keep advocating, we'll keep speaking to the policy leaders who we have access to. hopeful that things will change in the near future. Regarding what's it called? The aspect that has to do with the curriculum. In our own small way, we've started engaging with different institutions. We're in conversations with the biomedical engineering, the biomedical science department in Lagos University Teaching Hospital in Lutz or Unilag, with their HODs. We're trying to see how we can even start up, even if it's a zero credit unit course program, okay, just to help people understand what the present day reality is like within that space. We've also opened our doors to internships to different institutions, and it cuts across both for doctors, scientists, biomedical engineers, phlebotomists, and we have those programs running. And also in my alma mater, we already started conversations also in how to work with them in reviewing some of the curriculums. But again, we won't have a major milestone here, because whatever we need to do has to come from the agency that manages or that deals with curriculums for the country as a whole. And I believe that there are other bodies also working. Sorry?
I said that's NUC. NUC.
Yes, the NUC. Yes, that's the NUC. And I'm aware that at least my council is already working with them. I believe the same thing with MD Can, but it's a long-term project. So in the short term, institutions such as SYNLAB, Lancet, and the rest can actually work directly with institutions, maybe offer them zero credit unit courses, just let them have a feel of what it looks like to work, to see what practice in the modern day looks like within our industry. I think that's one thing we can do easily. Thank you.
Thank you so very much. Because of our time, we'll just take the last question, and I want to direct the last question to Dr. Dami. Okay. How can we? No, that's not the question. Okay. I think I can find a question. All right. I think we've had a very purposeful time this morning in this conversation. And I want to believe one of the objective of this conversation is to be able to trigger us to think deeply and help us to take decisions that would help to improve our healthcare system in the country. And you will agree with me that a seasoned presenter has been able to, elaborate extensively on the subject matter. Because of our time, I would not want to go over the summary again. I would just want to appreciate everyone on this call. I can see from our list that there are participants, from across Africa. I saw someone I saw someone from 2 African countries. Those are the people I could cite. I want to appreciate you, and I'm sure there are people from all over the world that would also have joined us on this call. I want to sincerely appreciate you, and I want to believe that we have learned one or two things that would help us as a people to play a role in helping to improve the healthcare system. And of course, when I listen to Dr. Dami and apropos doctor, I could also see, the impact they are making within their own, within their own space. So if me and you, within our own various spaces, were able to do our own, bit by bit, and of course, this may have the capacity to also encourage the government to do something, and we realize that will be trending on the positive direction. So I want to specifically once again appreciate all of us who have participated on this call. And also I want to appreciate all our presenter. I want to appreciate apropos doctor for the dimension you brought into the conversation. Even though you didn't ask the appropriate doctor that would know, want to appreciate Dr. Dami for the insights. I think personally, you've opened up another, sphere for me that as a person that I will need to read more, study more, and understand, know more about it. And of course, to our Chief Executive Officer, we thank you for your insights, especially for the table, the comparison, and for me, that summarizes, the whole concept of the conversation. Thank you so very much. And before we round up, I want to appreciate, on behalf of the Chief Executive Officer of SYNLAB Nigeria, I want to appreciate all of you once again, and I want to appreciate SYNLAB for putting up this webinar, which I believe we are all benefited from. This is just the maiden edition of a series of webinars we're going to be having, and I want to encourage you that when we call for another, we still hope to have 2 or 3 of these before the end of this year. And I can assure you that it's going to be quite impactful, like these or beyond this. And I will encourage us that when we call, still endeavor to join us on this call. So again, on the final notes, on behalf of the Chief Executive Officer of SYNLAB, I want to appreciate you for your time, and thank you so very much. I am Dr. Afolabi Obe, consultant medical microbiologist for SYNLAB Nigeria. Thank you. I think it's a convenient time to draw the curtain. Thank you, everyone.